So I grew up in Brazil, where abortion is criminalized for both people who get abortions and the people who provide them. But growing up, I did learn, especially from my dad, who is a doctor and works in public health, that in effect, people who have the means can obtain abortions easily and safely if they can pay for it, even if not legally in Brazil, while people who don't are the ones who have to put themselves at risk to exercise that same bodily autonomy. I found out I was pregnant exactly 1 week before my 24th birthday. At that point, I was waiting tables for a living, which was fine at that moment, albeit precarious to live off of tips. I was renting my own little studio apartment with no roommates for the first time. And I knew I didn't want to be pregnant by the time I turned 24. It was a very easy decision to make because of a fight that was going on in Texas at that time. I expected the worst, opening my computer to search for abortion care because for all I knew, my local clinic had closed. I was fortunate that the independent clinic 15 minutes from where I lived was open and full operation. Going in, calculating, it's like, okay, how many shifts do I need to pick up to cover the cost of this procedure? Because I also assumed that insurance wouldn't cover it. Anti-abortion extremism in Texas was really good at just cementing that assumption. But again, at the suggestion of folks in the clinic, right? It's like, well, let's see. And I wasn't expecting much, but it covered my procedure. I do remember being struck by how gendered everything was, especially because there's infinite ways to feel at home or not in someone's body. And I feel at home in a body that a lot of people assume to be that of a cis woman. So it's always this negotiation between wanting to be seen and wanting to just move through that experience and get the hell out as fast as possible. I remember the nurses at my local clinic, from the nurse who gave me medications and we were joking about just how groggy I was going to be, to the nurse who took me outside to be picked up. And I just remember I felt the need to give her the tightest hug, and just all the compassionate providers that were there. My partner at the time was vehemently against my decision, and I couldn't talk to my parents for different reasons. And because I was able to navigate those barriers, I didn't want to bother calling my friends to ask for support, because I figured well, I got the abortion I needed, I'm fine. So it was an unnecessarily lonely experience looking back. But since then, I've been able to open up to folks around me who I trust, and that's been very healing. I hope that Jews and Jewish communities can approach abortion without assumptions, faith-based on one hand, not assume that every Jew supports and doesn't stigmatize abortion just because in our faith, life begins only at birth. And I also hope that communities know that supporting abortion goes so far beyond fighting for people's right to obtain them. Supporting abortion means caring for and affirming people who have had any number of unique abortion experiences, because every abortion is different and equally valid. And having the right to an abortion doesn't mean being able to access it.